Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my producer, Lindsay, today. And today we have Dr. Sam Madeira, naturopathic physician that practices out of Seattle and Montana from the Apollo Health Clinic. And we are going to be talking about men's sexual health today. And he has counseled thousands of men on this issue, and this issue is a big issue. There's a most of things that we can prevent, and sexual health is very important. It's a very, very important part of our lives, and we want to make sure that men are optimizing their sexual health. So we have invited Dr. Madeira on our podcast today to make sure that's the case. So Dr. Madeira, welcome to our show.
Thanks for having me. I'm excited to talk to you about this. It's a big problem for a lot of people, and I think a lot of them don't know that there's some easy fixes potentially, and other fixes and solutions that maybe take a little bit more involvement, but there's definitely a solution.
Absolutely. And let's just kind of qualify and define a little bit when we say sexual health. I look at it as there's three components. So sexual health would be desire, so libido, or lack thereof, so not just wanting to have sex, and then the second one would be for men would be erectile dysfunction, which can be, obviously affect sexual health, and the third one would be lack of orgasm, and that is definitely an issue also. And there are many medications that can affect all three of those things. So I think that's one of the important things. Many medications, prescribed medications, and medications that are used either legally or illegally. And we are going to discuss those today because it can have a big effect on all three of those. So let's just go into that now, Sam, and let's just start with, because I know you've been, I follow you on Instagram, and you've done a big educational program on beer, specifically IPAs and sexual health. Can you go into that a little bit now?
Yeah, absolutely. So pretty much all beer has hops in it, and IPAs and some other beers have quite a bit more hops in them. And there's a couple of things with hops. Hops is a phytoestrogen, so it's a plant estrogen, and it's one of the most potent plant estrogens on the planet. It's so potent that when young girls who are, haven't had a menstrual cycle yet, harvest it, usually the next day they start their menses. So if they're 10 or 11 and they are harvesting a lot of hops all day, then the next day they can start menstruating. And it's a calming herb. It's been used in herbal medicine for hundreds of years for insomnia. It's very bitter, so combined with other herbs it can help with digestion, especially with the stomach and stuff like that. But since it's such a calming sedative herb, a lot of men actually aren't after alcohol as much as they may think, as more the hops, and it's basically they're self-medicating with the hops. And hops has a lot, there's a lot going on with the chemistry of it, but basically it's a plant estrogen, and if you get enough of it, we actually see men's estrogen levels in their blood go through the roof. So that's a huge issue, especially if they're on testosterone therapy and they're injecting or using a cream of testosterone. Their estrogen level will skyrocket, and they'll have erectile dysfunction. When you have that ratio of free and total testosterone off between testosterone and estrogen, that's a huge issue. So that also can lead to other problems later on. But mood issues, which kind of play into this low libido picture, this patient picture of somebody who maybe seems a little depressed or just unmotivated. They may have mood swings. I'm not saying that hops does that all by itself, but there's other things that are already in people's lifestyles that could be contributing to that and do, having a lot of inflammation in the body. So this perfect storm with drinking a lot of beer. The other issue with beer in hops is that hops is sprayed with Roundup, and Roundup is the other name for it is glyphosate. Glyphosate is a chelating agent, so it pulls out minerals out of the body, but it also has been deemed carcinogenic and linked in multiple court cases to lymphomas, specifically lymphomas and breast cancers. So you have people that are, have sued Monsanto because they're basically dying from lymphoma, and they get maybe a couple 100 million and then they die. So the issue with hops is actually greater than just messing with your sex life. It could contribute to cancer, and there's a lot of things that contribute to cancer or can be part of that picture. Usually it's multifactorial, autoimmune disease, etc. So case in point is they dry the hops with glyphosate. Hops is a plant estrogen, and I mean that's basically the way to think about it. You're basically drinking estrogen. So if you're eating a paleo diet or a keto diet and you're drinking a lot of beer, first of all, beer is not part of those diets.
Right, right.
So you can't
But
really
yeah,
be keto and drink beer.
right. Although I'm glad you comment on that because I see many people that do that, and it's like, well, no, I'm eating keto or I'm eating paleo, and then they're drinking large quantities of not just beer but alcohol, and it's like that kind of in some ways defeats the purpose. So yes, keep going, please.
Yeah, absolutely. So, I mean, alcohol itself increases estrogen too. So, moderation usually, I mean, if somebody can take 1 month off of alcohol in the first half of the year and 1 month off in the second half of the year, just to let their body kind of cleanse out, because alcohol does have a lot of detrimental effects. And they've done cross population studies, these massive longitudinal population studies between countries where, because of their religion, they don't drink alcohol, and then countries like Britain where they drink a ton of alcohol, kind of like people do here in the Pacific Northwest. And they showed, to the shock of the researchers and people who were overseeing these large trials, that there was no amount of alcohol that was approved as healthy or, in their words, safe to consume. So a lot of this belief that I'm drinking, a bottle of wine a week, and which isn't that much wine, or I'm drinking a bottle of wine a night, and I'm getting my resveratrol, and a high-powered antioxidant that's connected to a lot of longevity studies. You can get more of that in a supplement, high-quality supplement that I can prescribe for you for not that much money, and save your money on your wine membership, and possibly prevent something like breast cancer in women or other cancers with drinking too much wine, because wine is full of glyphosate too. It's also chock full of mold and things like that. So I'm not trying to scare people away from enjoying their beverages, but if you take 1 or 2 months off a year, and then 2 to 3 consecutive days a week, and and then the days that you do drink, it's 1 to 2 in a day. So I know during this whole pandemic, there's been a lot of day drinking that I've been hearing about, where people are cracking open the bottles around noon, and then drinking the rest of the day, or even potentially earlier, and that to me sounds like alcoholism. So if that's going on with someone, they may need to get into treatment. That's a little bit more severe. That's not really what I came here to talk about today, but I know that alcoholism is a huge problem, especially in the for a lot of men who are suffering from that. But yeah, I mean, if you can still enjoy and have one or two and take it or leave it, and if you can find organic beers, there's organic beers you can look up online, and try those instead. That would be a good way to go. And I think in life we're meant to enjoy things and have a good time. So if you, most of the time when you're drinking, if you're having a good time, and you're not like huddled up in a corner by yourself getting drunk, or in a bar by yourself just getting tanked, I think it's fine, as long as the conditions are mostly joyous and healthy. And, I'm not here to like tell people how to enjoy their lives or whatnot, but I think that it's fine for most people to have a couple of drinks here and there. But there are a lot of people that, overindulge, and it's just a matter of switching to other ways to cope with their stress and socialize. And I think especially with men, ironically, beer has become this macho thing and
Yep.
has been for a very long time. Kind of like how, back in the Marlboro cigarette days, like cowboys were, in the ad smoking cigarettes, and um, then they died of lung cancer later, and then everybody freaked out. And now people are still smoking cigarettes, but mostly more outside of the U.S. as far as I know, um, compared to what's going on in the U.S. with cigarettes. But with alcohol, it's still this kind of macho thing. You see it in movies, you see it in advertising, you see it in your friends, in your community, and it's ironic because beer is the furthest thing from being macho. So, if you want to do something to improve your testosterone, go do a workout, go for a hike or lift some weights, get more sleep, actually work on your muscle definition or something like that. And then you can kind of show that off. So, yeah, as far as that plays into sexual health, we see a lot of erectile dysfunction with people who drink too much, just inability to get an erection, and really high estrogen levels. So that's usually not what people want. And I've seen it happen with people just drinking like a six pack of light beer. They're not probably even really getting that drunk off of that because there's not that much alcohol. But again, there's a lot of hops. So
Well, and I've seen studies that, one or two beers can affect your sexual health and not just erectile dysfunction. Usually that's more when, from what I've researched, is more from when somebody overindulges and gets drunk. But one or two beers can affect the ability to orgasm, um, because alcohol is a drug, and that's what people forget. And I like your comment, too, about alcohol, because this is what I over and over on this program, I've said this and I'll say it again, and it's not that I don't drink sometimes, but alcohol is a poison, period. And when alcohol is in your body, it is looked at as a poison, and your body does everything it can to get rid of that poison. And that also means there's a lot of other good functions that are going on in your body that cannot happen anymore because your body is so tied up dealing with that poison. So there is no amount of safe alcohol. That is just true. It is a poison, period. So I know that wine study, like you were kind of referencing, Sam, especially with red wine years ago, they say, oh, one glass of red wine a week or a day, 1 to 2 glasses a day is great because it's got antioxidants in it. Yeah, I'm with you. I think 1 to 2 glasses a week is plenty for any kind of alcohol, and still, it is a poison. But those antioxidants that you get in that alcohol, in that red wine, you can get that with, colorful fruits and vegetables too. So I would rather indulge in those than the wine because it's just a lot healthier for you. So in so many ways, when you drink alcohol and you're trying to be on an exercise regimen, it's really hard for your body to recover and get stronger and get bigger when you're trying to process alcohol as a poison. So I appreciate your expertise on that, Sam. Thank you for sharing.
yeah, you're welcome. Absolutely. Yeah.
So let's move on to, speaking of another drug that's very common, especially in Washington State now that it's legal, and especially in the younger generation. I shouldn't say that because it's been around forever and people have used it forever, whether no matter what the generation, whether it's legal or illegal. But marijuana, let's talk about marijuana and sexual health. How does marijuana affect sexual health?
Yeah, absolutely. Well, I mean, so first of all, cannabis, there's different strains. It is in the same plant family as hops, so it's also phytoestrogen, and which is the cannabis family. And in my opinion, it is a medicinal plant and can be used appropriately. And, there's strains of hemp that have really no THC in them, hardly any amount of THC in them. And you can use, CBD from a quality source for, topically for pain and things like that. And, I just want to say that I've seen a lot of great things with medical cannabis, and unfortunately Washington State has kind of ruined that over the years, because the recreational cannabis side really went hard against it, lobbying against it in Olympia, Washington, so in the state capitol. So most of what's happening here, and why I say that is most of what's happening here is the THC in cannabis is what's affecting, inhibiting basically the signaling hormones. There's LH and FSH from the anterior pituitary gland in the brain. So basically think of, there's these messages from the brain going to the testes and saying, make more testosterone. That's getting basically stopped or slowed down depending on how much THC somebody's consuming. So if somebody is, smoking cannabis every day or every other day, every night before bed because they have chronic pain or, insomnia, anxiety, there's other natural things that can potentially help with that. And you could, maybe back off some of that THC intake. I've had people message me anecdotally that they were consuming a lot of cannabis for about 3 to 6 months, and their total testosterone went below 200, which for the listener, you want your testosterone ideally at least, 700 to 800 total testosterone, 30 free testosterone, nanograms per deciliter, and, or higher. So for total testosterone, 800 to 1200 would be awesome. So, or potentially higher if you're, really doing a lot of exercise and weigh, more than 200 pounds. So anyway, the point being is that this is inhibiting testosterone. So it's going to inhibit that libido. It's going to inhibit your ability potentially, eventually, and in this person it did, to achieve an erection. And I mean, like you said, young people potentially are consuming more. Usually, a lot of people are experimenting with cannabis, and potentially they're late teenage, and then they may become a lifetime cannabis consumer. THC from cannabis is causing issues with increasing cortisol in the adrenal gland, and the adrenal gland plays a lot into libido, basically how you respond to stress through cortisol. And I recommend most people who are concerned about this get a free cortisol test, saliva or urine test of their cortisol levels throughout the day. It's usually 4 to 5 samples throughout the day. And cortisol is a stress hormone, for lack of a better explanation, and for kind of an abbreviated explanation for the audience. And when you have cortisol disruption like this, it can really play into the low libido symptoms that some people may get from consuming cannabis. Not to say that everybody who consumes cannabis can have low libido. You actually, some people, there's the endocannabinoid system in our body of receptors. There's CB1 and CB2 receptor, and everybody's system is a little bit different with these receptors. So it's not, I can't make a blanket statement that everybody's going to have low libido, but there is a strong inhibition of LH from the brain to the testes, decreasing testosterone over time. Not to say that if someone is, consuming cannabis once a month, this is going to happen. This is more for regular higher consumption. Also, for kind of in general, just inhibiting the production of your steroid hormones, which testosterone is one of them. And across the board, there was basically agreement in the research that this is causing low sperm counts, so infertility in men. And a lot of people are dealing with infertility today, so that's why I mentioned that. While it may not be related to your sexual health, for a lot of married couples, at least earlier on in their marriage, their goal with sex is to have a child eventually. So, which may sound obvious, but if you're consuming cannabis and cannabis plus alcohol, you're going to have lower, in high quantities, you're going to have lower sperm counts, and that could be the main issue. Instead of spending $5,000 at a fertility clinic first, look at these easy things that you could potentially decrease and cut out of your life. And then you may be healthier and you may not have to spend all that money at a fertility clinic. It may be more about what you're putting into your body now. And that's usually the case with a
Absolutely.
lot of people.
And thank you for that education, because I wasn't really. I mean, you can see that clinically in patients that consume cannabis regularly, but marijuana is a CNS depressant, and and it depresses hormones. And if it depresses testosterone, like you were talking about through the LH and FSH system in the pituitary, that makes a lot of sense, because in general, marijuana is a demotivating drug. And yeah, it helps because it is a CNS depressant and stuff. It can help for chronic pain and stuff. But my theory is if you have some kind of pain, chronic back pain or something like that, and you're self-medicating with marijuana, there are a lot of other ways to fix that back pain rather than using a drug self-medicating. And yeah, it makes a lot of sense, Dr. Madeira, for if it decreases testosterone, cannabis decreases testosterone levels, that makes a lot of sense why a lot of people that smoke marijuana regularly are demotivated. So, not just for sexual health, but many other reasons to not smoke cannabis regularly. So, thank you for that education tip.
Absolutely.
Now,
Absolutely.
here's one that we were talking about in our connection call pre-show, and a lot of people don't realize this, but training and overtraining can actually affect sexual health. Will you expand on that a little bit?
Yeah, so overtraining is going to actually eventually increase your cortisol, going back to the adrenal hormone. And when cortisol is too high, you're going to have lower testosterone. So the perfect storm would be somebody's training for a competition, maybe they're a triathlete or something, and they're having to overtrain because they started their training cycle too late and they're trying to catch up or something. And then on top of that, they're in their company or they're, working at their job and they're not sleeping that much because of the stress of work combined with training. So just the sleep alone will decrease testosterone and decrease libido and morning erections and lack of sleep, that is. And that's been researched in large population studies. Actually, lack of sleep is more an issue aging for just you're going to lose more testosterone from not sleeping versus being 5 years older. So going back to the overtraining is you're jacking up cortisol if you're not getting the rest time that you need in between workouts. And the great thing now is there's technology. I mean, you can get, they're pretty expensive, but you can get some of these watches, these more fancy watches like Garmin or Sunodo, especially if you do a lot of outdoor activities and, things like you do a lot of mountain biking. Other people may do more mountaineering, like Sunodo watch is good for more of the mountaineering potentially. And it can tell you after a workout, you record your workout and at the end of that workout, it will say rest for 24 hours. And that for the listener, that doesn't mean, and most athletes will probably feel anxious if you tell them not to do anything for 24 hours.
Yeah, right.
Usually that's active recovery, right? Like don't sit on the couch and be a couch potato for 24 hours, do some stretching, go for a walk, go to the playground if you have kids and play with them and run around. That's, still fine. But what we're talking about is like, don't try to go and do, 5x5, like deadlifts and power lifts and stuff that right 8 hours later. So I think a lot of people overdo it, myself included. Usually when I get into something, it's, I'm gung ho and I want to stay on a schedule and all these things. And that's why it's also important in some cases, especially if you only have a little bit of information on how to train or do weightlifting, is to hire a coach. And a lot of coaches today are doing the virtual thing through Zoom and in other ways. So you can do that as well if that's something that you can afford and is important to you. So overtraining, think of it in the simplest terms, potentially you're going to see this great increase in cortisol, especially if you're doing a lot of cardiovascular training and not doing any weightlifting. We call that chronic cardio. You see a lot of increase in cortisol and breakdown of muscle tissue even more. And that's why you see like these ultra marathon runners who are, just super lean and don't have much muscle mass. And there's there's a great book called Primal Blueprint by Mark Sisson. It's been around a while now, and Mark has his website, Mark's Daily Apple. I have no affiliation. I just like the work that he does. But he has before and after pictures when he was in his 20s and 30s doing these large marathons. And then he has, and he was very, very thin, not much muscle mass. And then now in his 50s, and he is paddleboarding and doing push-ups and pull-ups and playing ultimate frisbee and lifting weights and stuff. And I mean, the guy looks completely ripped. He looks like a completely different person. So that's a great visual example of the difference between chronic cardio overtraining versus doing a lifestyle workout routine that is allowing your body to recover. And it's kind of how we evolved and more primal, if you will.
Yeah, I that's a big problem with endurance athletes. Their body composition or lack of a lot of lean body mass. I mean, they might be lean, they just don't have a lot of muscle mass, and that can be a problem with many different disease states, including osteoporosis. And that's I've been pretty fortunate because I have a powerlifting background, and even though I'm an endurance mountain bike racer now, I still believe in putting on a lot of lean body mass, and because as we get older, it's a lot harder to put that muscle mass on. So, big believer in that. So thank you for that tip. Overtraining, it's not as much as overtraining really is, and this is what my coach tells me, and I love your comment about getting a coach because it's not about working out harder. It's about the first 3 words out of my coach's mouth when I met him was, we're going to teach you how to recover. Recover, recover, recover. It's about recovery. So it's not necessarily about overtraining necessarily, although it can be, but it's about recovery, and recovery is really, really important. So what else do you have to say about the actual training or overtraining? Is there some hours, time limits that you know of when it comes to overtraining and sexual health, or is that really, really personal?
I think it is individualized. And I mean, if you have somebody that's been an athlete pretty much their whole life, and they're, used to being very active on most days, then, they can probably go a little bit harder. I mean, also other things may play into this. Their overall cardiovascular health, and especially their vascular system. When you're talking about erection health, usually, things like atherosclerosis are going to happen in those smaller capillaries before they happen, before you really notice them, even though they are happening in the rest of the body at the same time. So if someone's, having erectile dysfunction and they're very physically fit, you can still have clogging of your arteries, and that could already be happening in the penis already without you knowing it. So it may be related to the training, it may be more related to your nutritional plan. But I do think it is individual. And I really like what you said about the recovery. It's about recovery and how you recover. And that, for me, that usually goes back to testosterone. So if somebody has very low testosterone, a lot of men may not have any sexual symptoms. And I just say this because someone could be listening today and they may think, well, I don't really have that many issues. I don't really have any issues with the sexual stuff, but they're just not recovering from those heavy workouts or those harder workouts like they used to. And it's taking longer for them to not have sore muscles or, not feel the workout as much. So that's something that I hear a lot from men. And that's the key kind of red flag, that you may have lower testosterone than you want to have, and you want to optimize that testosterone sooner than later.
Well, one thing they might not realize either is, testosterone does decline gradually over time. So, when a man gets to be 50 and, his new sexual normal is probably a lot different than it was when he was 30, and he might just not recognize that. So that's why it's important to see, a doctor like yourself that can ask the appropriate questions and find out what really should what healthy should look like, because some men don't know it anymore. So what about some medications? I know as a naturopath, prescription medications are sometimes the last option. But they are, especially coming from a pharmacist, they are very useful and very necessary at times. I think, if you know mine and Janet's theory, it's we don't believe in a lot of long-term prescription medication for a lot of the chronic diseases that we traditionally see in our healthcare system. That's one thing that changed what Janet and I do, is we really focus on a health and wellness model, because we believe that our body, if we put the right stuff in it and we recover right and we eat right and we exercise right, that our body has a great ability to repair itself without a lot of medication, which, let's face it, medication for high blood pressure or high cholesterol is poison. So, and they're not without side effects. And there's a lot of blood pressure medications. There's a lot of antidepressant medications that can definitely affect sexual health. Can you go into that a little bit?
Yeah, definitely. So, absolutely. Yeah, the antihypertensive medications, the blood pressure meds are going to affect sexual health. And, you may be already doing testosterone optimization therapy, testosterone replacement therapy, and then be on a antihypertensive medication, and you may notice, hey, I'm feeling stronger, feeling more energy, but still having sexual health problems. And that's the time to go back to the doctor who prescribed that and figure out if you can take a different type of antidepressant medication that doesn't have that side effect, or if you can actually, potentially reverse the hypertension by, changing some diet and lifestyle things. So that's a key thing that it's seen, it's ubiquitous across the board, which the other issue is the antidepressant sexual dysfunction disorder. It's basically mainly from SSRIs, but we also see it with tricyclic antidepressants, monoamine oxidase inhibitors, and these, the dual neuroadrenergic, serotonergic reuptake inhibitors all have been reported in large research trials, double-blind trials, to have sexual dysfunction. Ejaculatory delay
Yep.
is one of the symptoms that you mentioned that is part of that, with the serotonergic drugs. So that's working on your serotonin. And actually, it's interesting because a lot of people today, men and women, actually don't have a serotonin deficiency. They have a dopamine issue. So if you need to be on a antidepressant medication for whatever reason while you're, going to a therapist, or you're working on trauma or something like that, these medications potentially could be life-saving for a period of time. And, in my research, they were actually designed to be used for about 6 months.
Yep.
While people were getting cognitive behavioral therapy. So the issue with what I see, it's kind of similar to, let's say somebody was put on a statin medication for a year and it's time to work on your diet. It's kind of a similar situation in this scenario, but instead of the diet, let's work on what's going on with the mental health, with all of this stuff that's going on in your life, and so that you don't have to be taking this medication at a high dose or at all potentially, and you may be able to eventually step down over time and switch off of this. Please, if you're listening to this, do not stop taking any medications after listening to this. Listen to your doctor, take your prescriptions, but go and talk to them and say, hey, if you are having some sexual dysfunction, hey, is there another medication I could switch to? And in some cases, things like Wellbutrin are better than some of these SSRIs. Like Prozac is a very popular one that a lot of people have heard of or maybe taking. So low libido, ejaculatory delay are basically two of the main symptoms we see. And then we see, in some cases it's weight gain with low libido, which now you have two things that nobody wants. And it's curious because you would think that someone would be more depressed if they had low libido and they were gaining weight,
Right.
So I know the mind and psychology is a lot more complex than that, but we do know that things like body weight and this inflammatory weight plays into things like depression, and depression isn't based on a lot of inflammation in the brain and the gut brain axis. So it's a lot bigger topic than, that's not our topic today, but just a side note, there are some root cause issues that are going on physiologically that play into depression. So these medications, my concern for a lot of these medications is that they, even after people go off these medications, you could have long-standing issues with ejaculatory delay, low libido for, they're showing these medications staying in people's bodies up to like 11, 12 months, at least affecting people's bodies.
Affecting, right?
The half-life is way gone,
Yeah.
but as far as pharmacology, but the way that they have still impacted and informed the neurotransmitter chemistry, the brain chemistry, is still informing the side effect. So it's basically, created a different pathway in the brain or made that pathway stronger. And it can take a while for people to unravel that. So that's my main concern, is not, if someone's having side effects and it's just a couple of months, you probably have time to switch this and not have that side effect anymore. But if it's been years and years, then this may be something that you really need to, dig deep on and try to unravel even more with maybe, a psychologist, your psychiatrist or doctor who prescribed the medication, and then a naturopathic doctor who specializes or knows how to work in these scenarios. So, yeah. And then erectile dysfunction is also a side effect for antidepressants as well. So that's, we got 3 side effects now from one, big group, multiple types of antidepressant medications.
Yeah, and that doesn't even consider that's just the sexual side effects. It doesn't consider the other side effects of, dry mouth and, the list goes on with some of those medications. So, and I agree with you that, they are needed. Antidepressants are definitely needed in many circumstances, or maybe in a few circumstances. But long term, I don't think they were ever really meant to be prescribed in most cases longer than 6 months. I agree with you, because there's so many other issues like diet and lifestyle. I've posted this and talked about it on our radio show all the time. The best antidepressant ever invented is exercise. Period. There is no better antidepressant than exercise. And you talk about dopamine. You want to increase your dopamine? Just go exercise. That's the best way. That's the best antidepressant. And I use it routinely, believe me, because there are many times where I'm not motivated to do a workout and I'm feeling a little bit depressed, and I do a workout and I feel like $1,000,000. So it's the best antidepressant ever invented. Sitting around on the couch playing computer games or watching TV is the best way to keep depressed. And get off the couch and move. That's the best antidepressant ever invented.
I agree.
So, let's not forget too. This is what I think commonly, people forget because they're not prescribed. But there's a lot of medications that you can take over the counter that can be dangerous and cause side effects. On our radio show Monday, we had a doctor on from Arizona that had a patient that was taking over the counter NSAIDs, ibuprofen and naproxen over the counter, and ended up in the hospital with renal failure, kidney failure. So, but he didn't tell his doctor about that because it's over the counter, so it must be safe. It must not have side effects. Well, that is absolutely not the case. And the ones that affect sexual health that are over the counter that I can think of are antihistamines. Benadryl or diphenhydramine is probably the one that I can think of off the top of my head that's probably the most common that could cause those side effects, because it's such a dirty drug and it affects so many different things in the body. But diphenhydramine, also known as Benadryl, for plain allergies, or people can use it for insomnia, because one of the side effects of it, even though it's an antihistamine, because the way it works in the brain, it causes drowsiness. That's one of the side effects. So it's in some medications to help people sleep too over the counter. So that drug can cause sexual side effects for sure, especially lack of or delay in ejaculation orgasm. So that's another thing to watch out for is over-the-counter drugs. So and if you have any questions, feel free to ask us or ask your pharmacist because hopefully they will know those things. And that being said, we'd love a caller today. If anybody wants to call in, you can call in and ask Dr. Madeira a question. 509-537-0411. We always welcome questions, or you can comment on Facebook if you have any questions, and we'll try to get those to him. As always, we have 2 podcasts a week. We have a Monday podcast that we stream live here on Facebook and live on YouTube on the Moses Lake Professional Pharmacy's YouTube channel, 1 to 2 p.m. every Monday. And our midweek podcast is usually on Thursday at 8 a.m., but it does vary depending on our guest schedule. So tune in for those and listen to us on your favorite podcast forums. So iTunes, SoundCloud, Google Play, all those, your favorite podcast forums, we are on those. So Dr. Madeira, how would you like to finish the show today? In 2 minutes, kind of sum up what you think is the best way that men can optimize their sexual health.
Absolutely. Well, decrease the toxins in your life, whether it be alcohol or other toxins you're exposed to, medications, and eat a clean diet. So lots of fruits and vegetables, meat, and get enough protein and healthy fats so you can make enough hormones. And if you don't know how to do that, work with somebody who can guide you through that. And then check your testosterone and estrogen levels, get your blood levels of luteinizing hormone, and make sure that all those are functioning the best that they can. And if they're not, then you may need to get some testosterone replacement therapy. And that is, life-changing for a lot of people. So, check your testosterone levels annually if it is 800 or above, and even if it is, check it annually. And then if it does start to go down, you'll know immediately that something's off and you need to make some changes. So work on recovery. If you're active a lot, make sure that you're having enough recovery time, and work with a coach if you need help with that. And then you should be in a pretty good spot there.
All right. I love it. Thank you for summing that up, and thank you for being on our podcast. And one thing, the purpose of this show is to educate and empower consumers that they are in charge of their own health care. So we have guests like yourself from all over the nation to help our viewers and listeners to keep them empowered and educated on their own health. And one thing that is very, we think in our society today that, our health insurance plan is what keeps us healthy, and we call it, health insurance, but it's really not health insurance. It's sick care insurance. I wrote a book about it. It's called Sickened: How the Government Ruined Healthcare and How to Fix It. It's available on Amazon in Kindle form. Go to Amazon, download it there. And one thing I talk about there in Chapter 6 is it's a 6-step solution on how to fix it. And many of the things that Dr. Madeira talked about today is it. I mean, first of all, it starts with you. It starts with the patient. It starts with you, the viewer, the listener. You're in charge of your own health care. I wrote a quote at the first of that chapter, and it says, "The best health insurance we have is not some policy we can buy. It's how we take care of our bodies." So it's what we eat, it's how we exercise, it's how we recover or sleep, period. Those are the 3 things that we can do to make our bodies healthy. There's a couple other details maybe that we could add to that, and a lot of details in between, that's for sure, because all those things are really important and detailed, but that's how we can take care of our bodies. And it's a movement that's really starting to gain traction. If you follow the podcast or follow our YouTube channel, there's when I started this revolution many years ago, people thought I was crazy, and now there's a lot of people that are realizing that our sick care system, our health insurance system, mostly government payment system, is not there to keep us healthy. And if you follow Spike Owen, Spike Owen is the Libertarian vice presidential candidate that is running for President of the United States with Joe Jorgensen. And they've got a couple of videos out there, and they talk about it, free healthcare. And not in free as in payment, but make healthcare free. Make it accessible. What they mean by that, they mean liberated. When people are in charge of their own healthcare and not the insurance company and not a doctor, then all of a sudden people are empowered. They're in charge. Service goes up. Prices go down. Period. So check out Spike Cohen. Follow him on Facebook or Instagram because he's got some great ideas, him and Joe Jorgensen. So he really speaks my language. And we're going to have him on our show one of these days. He's out on a bus tour right now, so he's staying busy campaigning. So he's had to cancel a couple different times, but I'm excited for him to be on. So check out Spike Cohen, vice presidential candidate for Libertarian Party. And Dr. Madeira, thank you for another wonderful show. I appreciate you being on. And I did send you a copy of my book. I hope you've had a chance to read it. And you've listened to another edition of Health Solutions with Shawn and Janet Needham. Thank you, Dr. Madeira.
Thank you.